I'm going to put this with these guys. Okay, bone hook. You do an amputation. You can hook this into the center of the bone. What's the center of the bone called? Okay, medullary canal. Okay, so you hook this into the middle of the bone. You just amputated the person's leg, let's say AK or BK. Okay, so we'll say we did an AK above the knee, right? You hook this into the medullary canal and you can pull the leg up because there's nothing left there to lift. If you only have a stump that's that long, it's hard to lift it up. And he wants to see the tissue underneath to make sure there's no bleeders or anything underneath that. You hook this underneath there, or you can just hook it around the bone itself to lift up the bone. Okay, amputation's about the only time I use this anymore. Okay, osteotomes. There's all different kinds of osteotomes, different shapes of osteotomes. Okay, you can see that this is straight. These have bigger handles on them, curved, straight, and different sizes. And usually it says someplace on there the size that it is, because he's going to ask you for a half-inch osteotome, and you better be handing him a half-inch osteotome, okay? Because it says on there. Most of them say, or it'll say on the rack which one it is, okay? If you hand him an osteotome, you're going to hand him a mallet, okay? And these are not light, but they do come all different weights for different types of procedures you're going to be doing. Naturally, they use osteotomes in the nose. You're not going to be using a big heavy mallet.
See how heavy it is?
They're not going to be using a big heavy mallet for on the nose. They're going to have lighter weight ones. Okay, so you're going to see all different sizes of mallets for different types of procedures. Okay, these you can make cuts into the bone. Okay, you can make let's say I want to do a bone graft on the iliac crest. They can use a saw or they can use this. Okay, and what you have to do, what's the outer hard covering of the bone called? No, the outer hard covering. The cortical bone, right? The next bone underneath is the soft bone.
Spongy bone.
Spongy bone is called cancellous. Okay? They have different kinds of screws and different types. The cancellous bone is what they used for bone grafts. You can't use cortical bone for bone grafts. So you have to take off the cortical bone in order to get to the cancellous bone. And you can take off the outer one by using osteotomes, okay, and making a box cut. Okay, so making two big cuts this way, and then take the smaller one and go across the top, then pry off that. And usually a lot of times they leave it attached so you can just put it down over the top again after they're done. And then they're going to take either the gouges. They can take a gouge, okay, and and take the bone out. And your job to collect it. Okay, when they take it out, he's going to be passing it back to you. Your job to either collect it in a cup someplace to collect it to use for the bone graft. They can also be using one of these, okay, to dig out the bone with. Okay, your job is to collect it and keep it safe. Okay, those two things are used for either bone wax, or you can use curettes to scrape off bone. Let's say the person has osteomyelitis. You're going to scrape away all the bad bone that's infected, and you can use this to do it. Okay? Curettes come in all shapes, all different configurations, backwards, forwards, bigger. Okay? Hollow handle versus solid handle. What's the difference?
One's for spine, one's for actual.
So one tends to be neuros. Neuro likes the lightweight ones, hollow-handled ones. The heavier ones tend to be ortho. Okay, not hard and true, but tends to be. Okay, this is called a ring curette. You can use it usually on spines, and you can, after they get into the disc, they can go around inside the disc base and ream out the disc, and then you take one of these things and go in out after what we just reamed out, and pull out all that tissue. Okay, we're going to come back to those. Okay, hips, we'll put that at the hip, then we'll put that at the hip. This is used for cranies most often. It's just like the big ones, malleable. Okay, brain spatula is another term for them. They come in all different sizes, all different shapes, or I should say all different sizes, and some of them are Teflon coated, or the slippery stuff. What do you call it? What do you have the ones that are covered with the
No.
plastic?